Hello, everyone. Just want to welcome you to today's Safety and Health Magazine webcast sponsored by Ideagen. Letting you know you're in the right place. Going to allow about another minute or so before we get going. But again, we thank you for joining us. Once again, want to welcome and thank you all for joining us. Going to get going in about another 30 seconds, just allowing a little bit more time for folks to get settled in. Okay, an official hello, everyone, and welcome to today's Safety and Health Magazine webcast, How AI is Shaping the Future of Occupational Health and Safety, sponsored by Ideagen. My name is Kevin Drewley. I'm an associate editor with Safety and Health Magazine and will be moderating today's session. Thanks for joining us. In a few minutes, we'll start our presentation, but first let's review some preliminary items. The views of today's speakers and organizations are their own and may not necessarily reflect those of the National Safety Council or Safety and Health Magazine. Any mention of a commercial enterprise, product, or publication does not necessarily mean the council or magazine endorses those items. At the end of today's webcast, we'll conduct a question and answer session. To ask a question, simply click the Q&A button at the bottom of your screen, type your question, and click the send button. Feel free to ask your question at any time during the presentation. You don't have to wait for the question and answer session to begin. We'll try to answer as many questions as possible, but because of the large number of participants today, we might not get to every question. Any unanswered questions will be forwarded along to today's speakers. At the end of the webcast, you'll be asked to complete a brief evaluation survey, and we'll let you know more about that after the presentation. This webcast will be archived, so you can access it after today's live event. To view this webcast and all of our past webcasts, please visit safetyandhealthmagazine.com/events. With that, let's go ahead and get started. Our speakers today are Cyndale Post and Pam Bobbitt. Cyndale serves as a global digital EHS&S Center of Excellence leader at Arcadis. She began her career in 2011 as a safety coordinator and has worked in her current role since 2022 as she strategically deploys EHSQ solutions to help organizations create safe, sustainable, and healthy workplaces. Pam is Vice President of Environment, Health, Safety, and Quality Solutions at Ideagen. She brings more than 12 years of executive experience in EHS technology, specializing in software solutions that enhance safety programs and drive measurable improvements. She has previous experience as an EHS manager in pharmaceuticals, automotive, and specialty chemicals manufacturing. Again, we thank you all for tuning into this presentation. Pam, whenever you're ready, go ahead and take it away.
Thank you so much. And we'll just do a little bit of introduction, just if you're not familiar with Ideagen, just a little bit about us. I'm not going to spend too much time on this, but we have a integrated solution that is helping our customers achieve their results um, in environmental health, safety, risk, and compliance. And I would like to introduce Cyndale. I guess we should have put our little intro slides. They're going to see our faces on the next slide, but you want to talk about Arcadis. And before I do, gotta love live seminar webinars and life that we are at. Cyndale is stuck in an airport, as a lot of us have experienced lately with all the weather. So apologies, but thanks, Cyndale, for being a trooper and coming on today.
Thanks, Pam. I appreciate it. So, just a little bit about Arcadis. We're a large global environmental consulting, design, and engineering organization, but we still put a lot of focus in digital leadership and transformation. And that's really what's great about I get to do, and that's the part I get to play at Arcadis is focusing on our digital transformation. So, thanks, Pam.
All right. So for our agenda, again, you've kind of seen us. We'll just give a little intro. You can see a little awesome headshots versus our travel worthy. I'm dialing from the UK today. So the introductions, which we mainly done, we're going to give you an intro to AI. AI, we hear it all the time. It's talked about, continuously, and a lot of people. don't understand what it means really, and it means many different things. I mean, it's yes, it's artificial intelligence, but there's a lot of different elements to it. So I know there's some experts probably out there. We just kind of want to level set, and again, kind of some people, unveil the mystery to it. It's and kind of give you some more information about it. Then we're going to go into some of those current AI use cases that have been starting to creep up in the industry regarding occupational safety and health, and having address and risk management associated with occupational health in the workplace. And then we're going to think about thinking outside of the box. Welcome to the future of some of the things that we're thinking about in Q&A. And we're going to do a little fun as we go into those current AI use cases. We're going to go back into memory lane and kind of talk about what it was like when we're both practitioners before technology and really AI comes into play. Uh, so again, just in case you didn't get our names and where we are, and you heard the background from us, so we're happy to chat with you today. So those introductions finalizing as we go into the AI models. So again, I just kind of put together. Kind of a smattering of some of the more common AI models that we're seeing, right? Of course, LLM, a lot of people hear it, LLM, and a lot of people don't know what it means. It's simply the large language models. And, what does that mean? So, the large language models are the advanced artificial intelligence systems, and they're designed to understand and generate and manipulate the human language. They leverage deep learning architectures, primarily the transformer of models, and they train on massive data sets. So, when you hear kind of like, we have to train the model, we have to feed it with data and put that in, that's when they're doing that large language model. And some of the applications for this are really around like that data summary. So if you see and you're using, so a lot of people are using like chat gtp or something, give me a summary, or summarize this for me. That's a lot of times where they're using that large language model for that. So, you've got to train it. So, some of the things that you have to go into that is you have to train it. You have to give it. That's where we hear sometimes you get these biases. If you've ever heard about, the AI has a bias, it's because the way that they trained it and they gave that contextual data to it, then it that's how it learns, and it learns from that. So you can, if you've ever heard that term and you didn't understand what that meant, it just means that based off of the way that the model was trained and using that data, it could create some biases. So again, that's why some people say that the AI is not accurate or it can't be trusted, and that's one of the ways that it can be. And so, if you fine tune it, and you start, bringing in more data, fine tuning it means, bringing in uh, discrete data sets that really pay particular to the question that you want to answer. It's going to be one of those keys to that. And so, really, the application is using chatbots use these. So if nowadays, I don't know if there's a website that doesn't have a chatbot, but chatbots, virtual assistants, they all use the LLM, um, and also the AI that's doing the language translation. So I'm sure you've seen it. There's a great commercial out there, right, that talks about, you talk to your phone and then in your language, and it presents the language to the other person. That's using that LLM as well. There's other ones that I put up here too. One of my favorites, if you see the Dolly, this is using that AI application and taking words to pictures. So you can, say, "Hey, I need to create a." It's really a lot of fun. I use Dolly a lot. Because it's like, hey, I want to create a picture that says this. So what that is doing is taking that context and it's translating it into a visual representation. So really pretty cool. A lot of applications and of course design. Some art is coming up with, created from the DALI. So those of you who have to put PowerPoint presentations together, and you don't have any, and you want to create your own, it's a fun thing to do and test. Just I will tell you, talk about inaccuracies. Just watch the spelling, because and this is again some of the things with the AI that you will learn, of course, is that you know contextually use it for for what you want, but know that it's not always going to be accurate depending on it. And in DALI, even though you will put in some things, I'll tell you an example. I was putting together a regulatory compliance training, and I was like, oh, I want this awesome visual and something that I had in my head, and I'm not the best person to draw. So I was like, oh, I'll use DALI. And I was like, I need, conceptually to do this. Well, spelled compliance wrong. And I'm like, are you kidding me? Like, I wrote into the prompt, right, compliance correctly, but it doesn't. But that's a cool element. If you haven't played with that, text to visual, that's the DALI. And of course, some of the other applications that you see here is that kind of that vision, that computer vision, being able to identify um, things and navigation. So all of the, if you're in LA, I know they have them in LA and New York too, with the unmanned taxis. That's what they're using. They're using AI to identify, obstacles and hazards. There, we could link it back to safety there. So they're identifying that through that computer vision, and being able to give context to it. I don't know, Sindel, if you wanted to add some of the, uses that you've seen, or come up with the different models.
Yeah, I'll just add a little bit. I think folks assume the Dolly can do things like take data and do a visual representation like a BI, and that's a little bit of a misconception that we're seeing, right? The Dolly really just takes visualizations and transforms those into something else. Also agree 100% on the chatbot. We're seeing a lot of chatbots. Some clients are wanting to allow a chatbot to log into their digital platform and complete execute action. So that's an exciting new technology that we're seeing clients really lean into.
Yeah, and again, I think it's going to be, some of these use cases that we talk about. So, just kind of an intro again, not to go in depth, but just give you a little bit of background for those of you who aren't do it. Most of us, I know, delve in and want to learn more. So, let's talk about before we do all this cool stuff with the AI, let's talk about not too long ago. Sindel and I go back a few years, and then of course in the industry I go back way more many years than Sindel, but a lot older. But we both came up with and I'm hopefully we have some smiles on the webinar on the other side, because I remember this, right? It is not too long ago where when you're dealing with safety, especially with occupational health, and we were talking about the clinics, and at my automotive manufacturing facility, my certified occupational health nurse, who is amazing and awesome as they all are, but she had the locked cabinet and the keys were on her. Like, I didn't even have, like, the cabinet's locked with the key. Her, the clinic is locked with the key. I could get in the clinic, but I couldn't access the files again, because, of course, that personal information. And and everything was done, like, if you're doing an ergonomic risk assessment, right? You're getting out rulers, and you're measuring, and then you're doing the calculation, and whether you used to, if you do it old school or do it spreadsheet, or just doing evaluations of like a safety walkthrough. You're looking around and you've got that manual clipboard, and I don't know, where do clipboards go these days? And the pencil. So we just kind of want to talk about, like, let's bring you back, because we have had so many just general technology advances, and talk about what it was like not too long ago. And so today, right, when we're introducing all this different technology, it really kind of changing it. So one, which really didn't put on here, because it's not really utilizing the AI, well, chatbots into your digital management systems, maybe. What are we using that artificial intelligence for today? A lot of people and a lot of uses, especially in occupational health, are really focusing in on that computer vision piece. We've seen a lot of technology and a lot of companies doing those ergonomic assessments using that computer vision. Some of them are trained to do the different methodologies like the REBA and the RULA, so that you're really kind of using that to do that accuracy and getting that really understanding the risk with that. The other thing with that we're really seeing, of course, that has been continued to be tried and stuff, which is quite interesting because of in the states, the new OSHA rules around wearables and smart PPE, right? Because that's where you get that element of that artificial intelligence as well. Streamlining and identifying and personalizing, some of these elements. So, smart PPE being able to capture that with sensory heat or temperature and be able then to react and light up in certain ways, to interact um, with other devices. So for instance, I came from Amazon. I was working with Amazon, and one of the things they always talk about with the smart PPE is they have, of course, Amazon use a lot of robotics and on the robotics floors. And so when an associate something breaks down and an associate has to go onto the floor, they wear a smart PPE, which is a sensor that actually sends out a message. Because if you can imagine how quick those robots move, and especially there's some that you that move around these big stacks of unpacked goods to go for packing, but then there's other small ones that zip around to shift all the packaged goods into the right chutes to go into the right boxes, right? So but the smart PPE then interacts with that AI, um, and tells those robots, the robotics, to stop, right, to prevent that impact and that hit. So these are a couple of the things that people are starting to use them for today, kind of testing out these different use cases. Again, really focused in around preventing injuries, right? So preventing that, you know um, for the ergonomics, the MSDs, which we know is super important. And then again, with the smart PPE, really kind of focusing in some of these high activity, things like, impact from different machinery or potentially fall from heights as well, in those indications.
Yeah, Pam, I'll just add a little bit as well. So, as a part of the computer vision, we're seeing clients, again, like you said, lean more toward monitoring the equipment, right? I think folks are starting into the ergo evaluation, but monitoring equipment and making sure that they're getting the adoption from their people, right? Making sure that as a part of this change into this AI type of technology, they're considering their folks and the impact it's going to have kind of on them and their long-term understanding of the goal of prevention and not a gotcha type of mentality. And I think we're all seeing us have to manage those expectations.
All right. So we have a question for you because we want to put this out. So this is our first poll question. We've talked a little bit about some of those different technologies, especially utilizing some of the first elements of AI. Have you implemented any of the following as part of your occupational health and safety program? Have you done wearables? Have you done some smart PPE? Computer vision? I think that's one of the most popular that I've seen over the last 18 months is using that computer vision. And then more than one of the above, because a lot of people are saying, hey, because everybody's still early in adoption for AI in safety and health. And so people are, testing out what can it be used for? Is it really useful? So you may have done more than one. And then maybe you're like, look, we're just really trying to get a handle on our current situation, or we just haven't had a chance to do any of those, because again, these are some newer technologies that have come in over the last 18 months or so. So have you done some wearables? We'll give everybody a little minute there. Have you done some smart PPE, computer vision, a combination of the two, or none of the above? And we'll just give you a little second there, and then we will get the results. Oh, wow. I, I are you see so I am seeing the results, and I am actually a little bit shocked about uh and it looks like everybody has answered 81%. None of the above. I think it'll be quite interesting. We have another poll question here in the end, because I'm hoping to dig out why. I'm really I guess it does surprise me. I thought it would. I knew it would be the highest, just based off of my Cyndale. Like, is that with Arcadis in your experience? Is that what you're? Did you expect it to be that high on 81%? And I like that there's a couple that have done more than one of the above. And again, of all of these, computer vision was 7%. So I'm hoping that all of the audience can see this. But yeah, so computer vision has become really popular.
Yeah, we're seeing it's a big buzz. A lot of clients are
So,
talking
sorry,
about it,
Cyndale.
but the difficult, like, I think.
You're breaking in and out. I don't know if you want to go off maybe camera, and that will help, and then start over.
How about now? Am I okay? I'm
Better.
so
Yes, better.
sorry.
That's
Okay.
okay. It
No,
happens.
what we're seeing what we're seeing clients do is they're talking about AI. They want to do it, they want to make the change, but their internal IT is really setting a high precedence on the privacy information assessment for all of the personal data related to health and safety. So we're seeing a lot of health and safety folks start laying the groundwork, but it's tough getting the internal team to really approve and understand the use case. And then when you're talking global organizations, you have multiple different regulatory bodies that have a different stance on AI. So I think we're going there, right? We were a filing cabinet, I don't know, less than 20 years ago, and we've made a huge transformation, right? Until now, Pam. So it's only a matter of time. We just need to start angling the hows. We need to figure out what next steps look like.
Yeah, and we're going to go into that, but you make a really good point, because I know we had one of the team here was asking me, they're like, well, where, because again, we're talking about sensitive data, and of course when you're talking global companies, you're talking GDPR on top of multiple other privacy acts, and with GDPR there's huge fines related to it, so everybody's kind of nervous. And they're like, well, where's the customer's data stored? And I'm like, well, AI doesn't store data. AI leverages data, and you have to, and I think that's to your point. And I think if that's why I like to educate people too. So AI doesn't store any data. It leverages data that it has access to. So that's one of the key things when you're talking to your IT departments, to talk about that, as well as that, hey, it only and it doesn't present any of that personal information and into it. So actually, I know that a lot of people are using one of the, and to talk about that, we have HOP is a, you know, human operational performance. A lot of people are introducing that to try to prevent the blaming that sometimes goes with incident management. So they're introducing LLM into the tell us what happened description of the incident management piece. And and one of the reasons is they want to make sure that there's nothing that is privacy, blame, etc., into that. So it's actually AI can help keep some of the sensitive data out um of things, because again, that detail. But it's good to know, if you didn't know, AI doesn't store data. It leverages data that it has access to, and only you determine what data that it has access to.
Yeah, and a great in between when you're talking with your IT is if you already have an internal language model that you guys are trying to develop, like Arcadis has one, so I can leverage my AI, but leveraging a different AI tool kind of isn't an option. And so those are some ways that you can work around with the internal team. But you're 100% correct. It's a really smart integration that has a lot of power in learning, but it shouldn't be stored, right? You don't want to store your data within your AI model. It's a pass through.
All right. So it was a great topic that we were going to get through, but I think it was an important one too, especially on with 81% of the people have not, leveraged any of these things we want to talk about. So let's talk about the future, right? We started talking about where we came from, and then kind of where we are today with some of the things that are going on. But as we know, AI is just going to get better. It's going to be more defined. I think actually last night at dinner here, someone mentioned that I think it was Google that was investing like 100 million or something into new data centers for to house, right? Because it's a lot of data, so more data centers are coming to do all of this. So I think AI is here to stay, and people are just going to continue to use and leverage it in different ways. So what do we think and what are the things that the future use for this? So one of the things that I'm always about, and Cyndale and I are going to talk about these. So I'm always about, how do you, because we're all different. And that was great because OSHA finally came out and said, right, PPE has to, uh, has to be appropriate to the person. And so thinking about that, right, we think about, um, if you're thinking about, instead of doing the computer vision for, looking at and doing an ergonomic assessment, why don't you turn that table, right? And make the equipment smart and use AI to scan the person and adjust accordingly based off of their size, height, etc., where their arms are. And they know, and you can plug into it, right? What are the optimal angles, and that, in the power zone, etc., that you want to be in, and do it from that perspective. What do you think, Cyndale?
Well, 100%, because the changing factor in all of those scenarios is the person working behind the equipment, right? So if we're able to really kind of contour to their needs, I think that'll make a drastic change. Plus, when you're talking about introducing an AI model to employees, there's a lot of hesitation and there's a lot of fear around being tracked from a person perspective, even though we talk about it's not holding your personal information, it's not going to know who is on the other side of that computer. It makes folks feel a lot more open to engaging with AI when it's not being tracked to them. I think that's a huge way to get your organization to see some of the benefits very.
Yeah, and I know Cyndale and I had a great. I don't know if she wants to tell it, but um, we're talking about the PPE and thinking about back in the day, and adjusting clothing to for the different PPE, in particular clothing. It's just, do you want to share that story? Because I think it's great.
Yeah. So I worked at electric utility, so supporting power delivery, transmission, distribution, generation plants. And so a lot of it was having to go on sites and really, in high risk areas. I am not a lineman. I'm not 6 feet tall. I'm barely 5'3" when I'm wearing thick boots. And so getting PPE was very difficult, to the point of where I would have to order the smallest size PPE and then take it to a special person and order FR, fire resistant thread, because it defeats the purpose if all of the clothing isn't FR associated to make alterations. And so I think it's wonderful that we're seeing that every support EH&S comes in all shapes and sizes, and our employees do too. And making sure that we're having readily available equipment for personal protection, regardless of the person or the size or the age or any of the other factors.
Yeah. All right. So so back to AI, we kind of talked about, hey, let's look at it from a different perspective. And again, thinking about the different use cases that we think, if you're thinking about it, and again, thinking about what you have to overcome, I always think about what have been some of the different barriers that we as health and safety professionals have had to overcome. And like, we care so much, and it's like, how what are some of those things, or what are some of the things we've never been able to solve, like if it could be better, we can make it better for all of the employees that work, and have them be more safe. So one of the things, I always think about is, just remember that, especially with some of these like hazard identifications, and there's different programs that I know everybody tries, and like that hazard identification, can you, like, nobody yet is really using, I think, computer vision. And again, instead of kind of looking at the people and some of those barriers that you talked about, Sundal, that people have on doing those ergonomic assessments, think about using that computer vision, because again, it can see things, and it can see things that are wrong. So one, some of the easy things, how many of you are exhausted or just tired, and say like, why do we do it? Because people just pencil whip the safety walkthroughs, right, which are super important. Don't get me wrong, but how many are just, whether it's still pencil and paper, or whether you do it on a mobile device, how many times is this like, oh, I'm just going to go through the motions. And again, when you're in an atmosphere, it's like, wouldn't it be awesome? I mean, you got computer vision, have AI kind of view, and again, automatically generate, right, actions. So if it sees something that's not particular, especially in manufacturing, I know it's, very regimented, but it can identify things more quickly, especially again if you're tied into what are the optimal parameters um, for that you want to do. So having that computer vision really look at that, conduct those inspections for you, automatically identify it. But you also are going to like preemptive, like with hazard identification. So if you have that AI and it knows like air quality or air temperature, which are key into some, industries, that it will actually flag and proactively um, handle something before it gets way beyond, right? So, if it senses, an odor or something, being proactive in that evacuation before you get people sick. So those are kind of some of one of the things that I think about with computer vision that haven't seen a lot of use cases. And like I said, as the AI gets smarter, be able to tune in to these the elements. And then of course, going into data and data quality, which is always very key, right? Doing analytics and insights and things, and wanting that data. What are some of the barriers that we introduce, that are introduced, that are keeping our data quality poor? So we talk to customers all the time and their management systems that, just incident reporting. One of the things is, they want to know, say SIFs are highly popular, right? KPI right now, looking at those significant injuries and fatalities, but all of the training, think about all the training, when you have, most of the time the people that are inputting that data are going to be, operations that are not specialists in the EHS, and you've got a high turnover rate in a lot of the different industries. So keeping that training for somebody to be able to identify, a lot of people put a question, was it a SIF or was it a potential SIF, yes or no? And I'm like, how are you going to help make sure that that's accurate with that information? But that's where AI can come in, right? And do kind of these like support training. So, if you train that AI with your policies and procedures in your world, being able to say, and that's one of the things that we're doing here at Ideagen, is we're contextualizing that to the person within a management system. So if I'm presented with that information and saying, hey, um, um, I have that AI subject matter expert telling me, based off the information that you gave, right? It is, this is the classification of the incident. Yes, it is a SIF because of these reasons. And the severity is this because of these reasons. And the person's putting that in, but they actually feel kind of good and confident and things about that. So thinking about, what are some of the barriers where you have had within just, your management system, like training, etc., and thinking about some of those already existing AI models and how to use those effectively. You're nodding along, Sindel, so I'll let you jump in.
Yeah, sorry. If I'm too loud, you just tell me to stop. No, I think another prime example is a clinician trying to manage an overall health for an employee, right? We need to see medical charts, we need to see allergies, we need to see ongoing issues, all of these different types of restrictions, data, qualifications, physical abilities, and tests. So being able to have all of this together in a way that can be understood can help us make fast, quicker, and better decisions for our people. And I think that's something where we're used to logging into one system or exporting it to Excel or going somewhere else, and being able to have something help us accumulate all of this information and put it in some type of visualization, I think is a huge benefit. I think we're going to have to walk through some of the uncertainty, and we can't just trust it. It's not something where whatever spits out initially, we go in that direction, but we have to teach it and we have to grow with it. And it's a part of our evolution. And I think that's something that will help us make even better decisions as EH&S professionals.
Yeah, absolutely, and that is one of the key things that it's kind of, again, if you're using it in the right way, and again, baby steps and bringing that in. And I like that you said, don't necessarily trust it. You need to keep feeding that information. Again, keep it within, and this is again some of the conversations you can have with your IT department related to your AI strategy is say, well, one, data's not stored. It's a pass through, so it's not gonna, share any. It's not gonna share any sensitive data if it's not, taught to do that. So that's a key piece. And the other is again to kind of educate the people, right? The employees, because Sindel made a great point on, some people don't like the camera because they're like, oh, I'm being filmed. It's my personal thing. So, switching that camera from to the equipment adjusting versus, looking at evaluating the employee. So you don't even have to evaluate the employee. The computer learns to do that and adjust, the equipment learns to do that and adjust accordingly. And then, of course, those quicker insights, that's what we want to get to, right? That is the ultimate. And I always say, all this tech, so what? But where we really want to get to and why it matters is again, it's changing. And I was like, you know what, I'm gonna throw in a safety maturity curve because I can't help myself. Because again, that AI and all of the things that we talked about of like where the future is going. So thinking about computer vision in the same way, like thinking about, doing your inspections for you, um, doing the equipment, teaching the equipment to adjust to the person, being personal to that person, having that information around the allergens and the elements of the individuals that are going to play into that and piecing it together. Especially if you have, uh, we did a scenario where someone was traveling, just kind of, we do different use cases and stuff. And again, it's all about looking at it. How can we be better at proactively protecting our employees? And so, thinking about travel, and especially, it's perfect because Sandal's in an airport and we hear some coughing and stuff. But if you have to say, hey, like let's do like Sandal's traveling to this part of the world, or even in this section of the country, we have lots of data sources that tell us where the flu is significant, or where RSV, or where allergens, if she has severe allergies. And you can say, hey, proactively say, hey, your trip, because we know you're taking a trip because you put the trip through to your travel. We all have different, travel um, pieces that we put in to organize the travel. So they know Sindel's traveling, and the A is like, Sindel's traveling, and here's going to be the weather, but here's some underlying conditions of Sindel. So let's like proactively send her an email. Hey, ahead of your travel, just wanted you to know, um, allergens are high, and remind her to take, hey, you might have to take your Claritin or your inhaler or something like that. But, here are the things to be aware of. And hey, there's a huge flu outbreak. It's red, right? On the risk matrix of flu outbreaks right now. Here are the things to look out for. And so then she's better prepared. So again, kind of think outside of the box a little bit. But the so what of that is stop being reactive and really going up that maturity curve to the proactive.
Yeah, and I think another piece is giving our folks the ability to self-serve. So like you said, Pam, like some automation from AI to kind of help feed and send that information. But as a clinician and an employee health and safety individual, I want to be able to find that data on my own. And I think that might bring us kind of to the transition as well, as how do I understand what my data means and what that looks like, and what is data literacy, and making sure that we're helping our folks who are evaluating the data to understand exactly what it looks like. And I think doing that on our own terms gives us just a lot more power to be able to serve our people.
Yeah, and it really does. And everybody has, health and safety professionals, we know what our biggest challenges are. And if you stop to think about it and just, take some time to think, what needs to be done, and how do I need, if I could do this, right? It's magic wand time, that you can do now. Think about, it's a capability to think, oh, I would love, if I had a magic wand, I would fix this. Well, think about what that entails. Talk about it with your different, IT. What data would you need to fix that, like to make that informed decision? Like, how's that coming in? And then you can start to build a really good use case and see that value, and build that out. And again, it's really around, um, overall, and improving that experience, not just for you, but also, for the employees, which actually helps with, that engagement. All right. We're going to go into poll question number two, because I think now we are really going to get to, uh, that, maybe why 81% of you have not adopted any programs, any AI into your program. So, is it fear of the unknown? Because again, that's where a lot of people come into. Well, kind of fear of the unknown. So fear not understanding AI, fear don't know where to start. Like just, you know, it's, what is it all about? The privacy issue. Can I do it? Is it because you want to do it, but it's the IT strategy? Hopefully we've helped a little bit today into how to have some discussions with your IT department about it. But if you don't know, what your IT strategy is, you can talk to them. And again, depending on the IT strategy, I know that, Cyndale talked about hers. We have one here too, at Ideagen. Is it the maturity of your safety program? Because again, a lot of people are like, wow, we're just, again, trying to get our management system and getting everybody on board in that adoption and aligning. So, we can't even think of AI. If that's the case, hopefully, as I'm letting people answer, this, hopefully we've given you some ideas on how you can use AI to help mature that safety program today, and some of the ways that you can think about it. Is it budget? We all know it's they'll that always, sometimes is a challenge. But here's the cool thing, though. Again, kind of ans- giving you some information as you're answering. There's a lot of, companies. And there's actually a lot of grants too, depending on what industry you're in, that are out there to invest in AI strategy. So you raise your hand. Don't be afraid. This is the time for health and safety to say, yes, me, please. I'll take some budget, or other, you know, and we can dive into that in some of the Q&A. So let's, go and look at what that is. Wow, it's pretty much even across. I think everybody, can see it. So we've got, 23% is the other in budget, um, 21% fear of the unknown and the IT strategy, and then, maturity of the safety program. So nice, good, uh, percentages here, kind of spread out amongst all of them. So, So again, we'll talk about this again. So fear the unknown. Hopefully, we've shared a little bit, to make you feel a little more comfortable. There's a lot of places I know that, Ideagen and Arcadis and the National Safety Council all do informational. You can look out and do some research for you to understand more. Hopefully, you got a little bit of understanding here today. IT strategy again, can't change IT, but you can have a conversation with them, right? And kind of, understand, have that conversation. Say, explain to me what our strategy is. Why is it this way? If we just kept the AI within our own firewalls, does that make a difference? So really do have those questions. Maturity safety program, again, AI can help with that. Gave some use cases, some simple use cases that hopefully can get that adoption, like that help in the training, like giving them the support, for that changing turnover. And then budget, uh, look and see, because no matter where you are, what size of the company, there's a lot of CEOs. It's kind of a good time. They say we're investing in an AI strategy, and we're investing in AI. Well, go find out like where that investment's going, and make friends with those people. Anything, we're gonna head into QA, but anything, Sindel, that you wanted to add that we haven't really covered with those, kind of how to overcome some of these barriers that we're seeing in adopting the AI programs?
No, I think we've done a good job of summarizing it. The only thing I would add is take some time to dig into your data and making sure that you understand the sources, and the solidity and the complexity and the accuracy of what you're pulling in. But other than that, I think we've covered all the models. Go ahead, Pam. I'll let you do Q&A, and you just call me when you want me to.
All right, I definitely will, because you know that I will always love your insights, Sindel. So all right, let's jump into Q&A. I think, Kevin, are you gonna come back?
Yes. Yeah, absolutely. Here I am. No,
All
excellent to both
right.
of you. Yeah, thank you and great job. We appreciate your insights and your expertise. Before we do start the Q&A, just want to let everyone know about the evaluation survey that we're asking you to complete. That survey will open in a different screen after this webinar. As always, we appreciate your input as it helps us to improve our future webcasts. I know there's a few questions in the queue already, but if you would like to ask a question today, just click that Q&A button at the bottom of your screen, type your question, and click the send button to submit. And with that, we will get to some questions. First one is kind of an observation into a question. It just says, generally, most customers I've spoken with have no idea about the AI innovations that are available. The ones that have heard of AI solutions show hesitation because of the questions pertaining to employees' personal information and/or health information. So with that, how would you approach customers with these concerns?
Yeah, I'll do it, and then I know Chris Sindel has talked to many customers, I'm sure, about the same thing. But again, it's kind of taking, what we've said. So one, the key thing is that, um, AI, and again, because everybody's afraid that things can share, and security breaches, etc. But I mean, I think that's one of the key things. AI doesn't store data. That's a key thing. So they know that their data, cannot be hacked per se, right? So that's a key thing for them to understand. The other thing for them to understand is that the AI will not pull any data that it is not trained to pull. So it's not going to, and most of the models will take what's called agnostic data, so just general, and not tie it to the individual person. The only thing with that is the computer vision, because you're doing, and we talked about that with that, but generally the AI and the AI models have to still abide by all of the privacy rules, etc. So when the data scientists are creating those, then they know that. So I think it's more, and I'll have to look and see if we can have some. There's some papers, white papers on that too. They can have it. So I think it's more about, with the customer saying, you know, let's talk about AI, and let's just demystify it for them. You learn about it, like what are your if there are concerns around data privacy, have those discussions that, like, look, the data doesn't, AI doesn't store anything. That's the key one. It's a pass through. It's only going to take data that it's trained on, and it still has to meet all of the privacy rules. I don't know, Cyndale, Arcadis, I'm sure, is probably doing a lot of this. Anything in additionally that you're helping with communicating to customers?
Yeah, start with the IT department. It's really key to understand what your company's process is and procedure in the future, and also make sure that you're over communicating and you're not just letting AI run, right? You're going to start a proof of concept, you're going to pilot it, you're going to roll it out, you're going to monitor it, you're going to do it at a couple of sites. So it is a long-term engagement and investment, and I think taking a bite-sized approach to making sure that whatever the clients are looking for insight wise, I would probably not start with people. I would probably do people as a second focus, and maybe talk about equipment or talk about inspections around a facility versus monitoring people and equipment. That would be my suggestion as a start off, and then you could grow your AI initiatives.
Yeah, and I think it's a key thing to just say, just thinking about Sindel and thinking about, the customer and employees too. They're all concerned, right? Big Brother is watching. I mean, talking about boarding flights, I boarded my flight from Houston Airport, where Sundal is, on Sunday to fly here to the UK, and I didn't have to scan my boarding pass. They biometricked me, right? So I didn't have to show my passport. I didn't have to show, right? But and if you go to some of the and that's the airport, right? So that they know, and they're passing that information to the UK as well, because that's the new manifest. It's biometrics to that. So and also TSA is doing that as well. So if you've been to the TSA, and it'll say this this data is not being stored, right? So I think that it just reminded me of that when you were talking about it, that they're so concerned of Big Brother, and you're going to be out there and capturing. But you know those are kind of examples to share that it's like, it's okay, we're using this in different ways, like for transportation as well, and at the highest level of government, right? The TSA is using this, and it will say your picture is not being stored. Hopefully that helps to have those conversations. But again, it's more about just educating, pulling that really understanding. And again, I like talking to the IT department, because they can help as well. Help their IT department can help them understand their data as well.
Next question asks, can relying on AI drop our guard and introduce additional risk?
If you rely on it wholly, absolutely. Right. That's right. AI should be a support system to help you. It shouldn't replace anything. So, uh, and again, I think Sindel said it, like, double check. But I mean, AI is a useful tool to help you. And I think about it as, if you've ever thought about, I say it all the time, I wish I could clone myself. Right? If I cloned myself, I could be everywhere and I could help everybody. So think about AI as being able to clone myself, but you're still gonna, double check, and you're not gonna rely on those clones all the time. You're gonna check in with it. So yeah, there could be. It's not a replacement. It's a awesome added support, is how I would see it.
And I would say the same. It's, just like with people, we have to have a level of accountability. That's not going to change with AI, right? There still has to have that accountability. And as a part of your model, what you'll do is you'll build in those checks and balances. There's a deviation over 100%. Okay, I need to look at that. It helps you funnel you can't see my hand. Funnel the information without having to see it, and it just be overwhelming. That's really the idea.
Yep. It's to facilitate you doing faster, better, right? Not to replace.
All right, thank you. Next question asks, how can AI-driven predictive analytics help in preventing workplace accidents and improving overall EHS compliance? And can you share some real-world examples of its successful implementation?
Oh, how much time do we have? Because Sindel probably is laughing. I can't see her, but she's probably laughing, because I'm gonna get on my soapbox talk about data quality, and people wanting to skip the hard part and go straight to the easy button first. So sorry, whoever asked that. I'm gonna just do a little chat about data quality and predictive analytics. Um, so what? So one, data quality. We know, and Cyndale and I were at a conference, and EY presented, and they were talking about a survey that they did with 9,000 EHS professionals, and they talked about, asked the question about how confident are you in your data quality, meaning how accurate it is, how timely it is, how complete it is, and what was it, Cyndale, like 37%, something like that. It was low in the 30s. uh they have the report that you can go see, but I think it was around 37% said that they were confident in their data, which means that we all know, and again, we all know because we are the practitioners of that management system, about how poor our data is at the moment in a lot of places because it is not timely, meaning it's been some time for it to come in. And so it's taken some time. So maybe the accuracy of that is not correct. Missing data. So I know that with customers, and also um, when I was on the other side, fields would be missing because even, um, yes, you had to put the required fields, but a lot of times to get adoption, you don't put anything as required fields. So, then it's like, okay, you just trust people are going to put in what they know are supposed to be put in. But guess what happens when you don't guide them into what what needs to be completed? They you don't require the field, you don't put the indicator that's a required field, and you can't save it because it's required. Guess what? They don't put anything, so you don't have complete data. And then we talked about one of the instances of that I talked about of, when you have rely heavily on outside of EHS professionals inputting data, that how it can be input incorrectly, not because they purposely do it. It's just because, training, they forget, like, how do you keep up with that and the definitions, because sometimes, and so it's not correct. And when you have data, so I'll stop my little soapbox speech. So when you have data that is less than 80% accurate, what happens is you might as well do a coin flip on determining what your prediction is. Is it going to be this or going to be that? Because that's about how accurate your predictive is going to be. It's about 50%. Now, that said, you can use the way that, and you asked for an example of where it's been successful. I don't have one, to be honest with you, where it's been successful. Where I've seen the most awesome application of that is taking data that is pretty consistent and complete, and kind of doing a mapping to kind of identify, identify when training needed to be done. So based off of like training competency, so based off of age, based off of tenure in the current job, and based off of it was age. There's three, but anyway, so they were trying to determine like where, when training competencies, and what it found out is there was a huge um oh, and the impact to the number of incidents. That's what the third one was. So kind of predicting, how do I predict where the incidents? So it's kind of using, hey, we're based off of these three things: tenure, age, and a number of incidents. Predict where I'm going to have the most incidents. But what it showed was is kind of like a graph of, um, those of you in the same range, apologies, but you should know. But between the ages of 40 and 50, there was an increase in incidents when you had a tenure over than 10 years. And so that's kind of interesting to use it, not to predict incidents, but to really say, hey, there's something going on here. Why? And again, we can kind of fatigue, midlife crisis, all that stuff. So you know that you can not necessarily prevent them, but you can put in controls right? To mitigate that risk of that increased incidence for that specific group of people. So that's the one place where I've seen it successful. That then they implemented some extra training and engagement programs as a control to that specific group to help bring down the incidence in that age range and tenure. Cyndale, do you
Yeah,
have an example?
just to add quickly, one prime examples are helping identify deviations in large data sets. So when you're talking sustainability reporting or you're talking SEER reporting or anything when it comes to data and numbers, it's able to look at a large data set and identify deviations a lot earlier than someone who would have to comb through the data and look. I've seen that example, and there are more, but I know we're right at time, Pam. So I know you'll want to say bye, but happy to help answer any other questions at a later.
Yeah, we'll get the questions to you, make sure we get them answered. But hopefully, again, for predictive analytics, it's got to be specific use cases for that. It's combing that. But I know we are at time. And Cyndale, thank you so much. And I know hopefully your plane is boarding now. She's like, all right, so we won't make you late. But thank you, Kevin, and thank you, Cyndale, for today.
Yeah, no, thanks to the both of you, Pam and Cyndale. It was a great discussion and great job. Unfortunately, we have run out of time, and we're sorry we didn't get to everyone's questions. But again, as indicated, all of today's unanswered questions will be forwarded on to our speaker. And once more, we do ask and hope that you take that time to fill out the evaluation survey that'll be coming your way to give us your feedback. With that, we end today's Bicontinental Safety and Health Magazine webcast. We'd like to thank Cyndale Post, Pam Bobbitt, everyone at Ideagen, and all of you who listened in. Thanks and have a great day.